Hi guys, my name is Kieran of One Zen Academy and One Zen Yoga. I hope this finds you well. So I'm just going to go through a few exercises that I'm sure will help the majority of people. So lower back pain or non-specific lower back pain affects thousands, if not millions of people each year. It's the number one reason that causes the most amount of disability globally. So you can imagine it's quite a big deal. We know it costs most governments, and by governments I mean kind of in the UK the National Health Service, okay, it costs us billions, and I do mean billions each year. So what we do know is we know that exercise, education, cardiovascular work like strengthening, stretching, all work to decrease lower back pain and prevent it in the first place. But there's no clear consensus as to what exact exercises we should do or the intensity that we should do them. So I'm going to give you, I guess, my take on the whole scenario based on 17 years of experience of dealing with lower back pain, chronic back pain conditions, as well as chronic back pain that I've suffered for many a year. I say many a year, I control it through exercise, cardiovascular training and yoga, funnily enough. So I'm going to take you through a few exercises. Do these exercises at your leisure, but make sure you include it as part of an overall activity in the week. So what we do know is that doing nothing is always the worst outcome, okay? So if you're feeling like your back's hurting and you don't want to do anything, do something. Go for a walk. The walk will actually help mobilization. So you've got your pelvis, and your pelvis will rotate anterior, posterior, front and back like that. Okay, we have to stabilize laterally as well, like this, okay? And I'm gonna show you how to gain some sort of control over that. What we do know from certain studies that the erector spinae muscles, the muscles that go up your spine, have a high fatigability in people with lower back pain. And what we mean by fatigability is just that, they fatigue very quickly. So we're gonna include some things to improve the endurance of the erector spinae muscles, okay? Excuse me. So there's an easy exercise that you can do first of all, which actually helps with pain management if you are in pain, and it's a pelvic floor exercise, dead easy to do. So you'll do it lying down, but I'm going to show you initially in this position so you can see what my fingers are doing. So you've got these two bony ridges that stick out. Everyone's got them. So you're going to find those bony ridges. So you've got your pelvis and the bony ridges kind of ping downwards. And we term that as your ASIS, your anterior superior iliac spine. You don't have to remember that, there isn't a test. But you're gonna find those, and then just on the inside, okay, if you squeeze your pelvic floor, and by pelvic floor, you're gonna lift up, okay, you'll feel, okay, these two little muscles pop up. It might be quite subtle at first, but that's your pelvic floor. So your pelvic floor is like a bowl shaped. Underneath, that's three-dimensional. And so we're just kind of making sure that we're getting some feedback from that. So the position you're going to adopt is an easy one. You're going to lie down, find those little bony ridges, go just inside and just touch the skin. There's no need to press in. You're going to breathe in, and on the exhale, you're going to squeeze your pelvic floor. So you're going to really pull up into your abdomen. You're going to feel those pop up, and you're going to hold for 5, 4, 3, 2, 1. Relax and breathe in, nice and slow. Nice diaphragmatic breath. Exhale, pull up, squeeze for 5 seconds. Okay? You're going to do that 10 times. And what this will help to do, it will override any pain mechanisms as well and gain control. So we know that pain can inhibit muscles from working. So what we're doing, we're trying to decrease atrophy, the amount of muscle that decays. And because it shares a similar nerve with your multifidus muscle, which is a supporting structure of your spine. So we've got the undercarriage here, okay, and it goes up 2/3 of your spine. Okay, we can ignite that flame, so to speak, ignite that spark to get those muscles active again. Okay, so you can do that 10 times. So 5 seconds contraction as you breathe out. Inhale for as long as you want, as long as it feels comfortable. Exhale, contract, 5 seconds. You're going to do that 10 times. Okay, so that's the first one. A nice easy one, and there's lots of progressions with this. I've just realized I'm on a hill. Okay, you're going to get in a 4-point box position. Make sure shoulders over the top of your wrist, knee underneath your hip, elbows out and ping them back around so your elbows are facing your thighs. Keep your head nice and neutral. Imagine it's been pulled through a little cord, so lengthening through your spine. You're going to inhale, and as you exhale, you're just going to draw your belly button in towards your spine without contracting the rest of your abdominals. So if you contract your rectus abdominis, you'll go into this position, which we don't want for the purpose of this. So I breathe in. As I exhale, draw my abdomen in. Inhale, relax. Exhale, pull in. And the more you do it, the more intense the contraction will be. Again, you're going to do that 10 times. So you pull in for the duration of your outward breath. So when you breathe out, the reason why we pull in is because your diaphragm will lift up, creating more space for this muscle here, which is your transverse abdominis, your TVA, to activate. And that acts as a natural weightlifting belt. So you're going to do that 10 times. Okay, easy so far, right? So the next step, okay, because now we're going to start integrating how our muscles would move as we're moving and grooving. So you're going to do the same. You're going to breathe in. As you exhale, pull in, squeeze pelvic floor. Now this time, without shifting your body weight, you're going to lift your right knee without shifting your body weight. Inhale, relax. Exhale on the next one, you're going to lift your left knee. Remember, without shifting your body weight. Inhale. Exhale, right hand. Hand down as you inhale. Exhale, lift the opposite hand, the left. Good. And you can go around as many times as you feel comfortable. I would encourage you to progress onto the next stage though. So as I lift my right hand, I'm going to lift my left knee. So I get this rotational element going through my spine. Okay, so I breathe in. As I exhale, I lift my right hand, left knee. A little bit tricky with this because you'll want to rotate, you may be off balance. Inhale, exhale, lift your left hand, right knee. Remember, pull that belly button in, squeeze pelvic floor. Good. The progression on from that is extending through those limbs. So again, as you get more comfortable, on the exhale, belly button in, squeeze pelvic floor, you're going to extend your right leg back, extend your left arm, and again, without shifting your body weight, without rotating, you're going to try and maintain that hip over that empty space. Breathe in. Exhale, belly button in, squeeze pelvic floor. Breathe in, and you're going to alternate. You're going to try and do 10 reps on each side. It'll feel quite tough, but it'll feel quite rewarding. You'll feel like this area is fully engaged, fully ignited in what you want to do. Okay? So that's an easy way to begin. On from that, I would do some sort of frontal or lateral type plank, and I'm not necessarily a fan of the plank, but in everyday walking, moving and grooving, okay, it's important that you're able to stabilize that lateral pelvic tilt. And when we can't stabilize, it's mainly to do with, yes, how our foot lands, the ground reaction force up, how we're dealing with gravity, but in between that, you've got these tiny little muscles called your abductors, okay, and they'll help stabilize laterally, okay. And an easy win, with no equipment, okay, is to go on your right arm. So make sure your wrist in line with elbow, elbow in line with shoulder, knees on the ground, lift hips up. So you've got this nice line here. So what we don't want to do is for you to flap your head around. So we've got this nice line here. That's stage 1. Okay. Stage 2, we can start opening up the hip. Stage 3, you can do a bit more of a movement base, so you can allow your hips to sink down and then open up as you come up. So now we're stretching the muscle at the bottom and asking it to contract. Okay, from there you can extend your lever. So the leg that's on top is forward, the leg that's behind is behind, funnily enough. You're going to lift up again, stage 1 of this lengthened position, and you can get your arm moving, and all that does is displace your weight. There's many ways to progress that on, but I would encourage you to do that on both sides. Start with just knees. If you're feeling you've got knobbly elbows, put a pad, put a cushion underneath your elbow, relax. It's all about the alignment initially and getting you used to that position. Belly button in, squeeze pelvic floor. So try those exercises out initially, especially if you already have lower back pain. Okay, it won't compromise, it won't do any more damage. Okay, we know that pain isn't necessarily associated with damage, and neither is an MRI scan or an X-ray. You could have those done and it won't tell you how much pain that you're in. Okay, really important to know. So do these exercises, give them a go. You leave a comment if you're watching this on YouTube. Yeah, I'll always get back to you, I'll always get in contact. Thank you so much, guys.